are moving now into the second unit of the course. In this unit and all the units that follow, we will be using or applying the moral principles that you learned in the first unit. We will be using or applying these principles to issues faced by healthcare professionals, issues you will face as you become a healthcare professional. I do want to draw your attention as we move into this unit to something that Post and Bluestein said in their first chapter about the use of moral principles. Here's what they said. The four ethical principles discussed above, autonomy, beneficence, non-maleficence, and justice, have assumed a central place in much of bioethics literature, theory, and clinical analysis. Now, of course, I have added a fifth principle, fidelity, which I think is also helpful. Back to Post and Bluestein. These principles are used in an attempt to render our moral convictions and the reasons for them coherent. Because these principles have validity and can be useful in thinking through ethical issues, they are referred to frequently in the following chapters, and we will be referring to them frequently. As a cautionary note, however, it is important to resist the temptation to employ principles in a mechanical fashion. If used with judgment and sensitivity, they can provide structure and inform ethical reasoning. Used rigidly, without reference to context and narrative, however, principlist ethics can lead to a distorted and unhelpful analysis. End of quote. Now, the first thing I understand Post and Bluestein to be saying rightly here is that the moral principles are useful for making our moral convictions understandable and coherent. We don't take these principles and generate moral convictions. Rather, we already have moral convictions. You will bring moral convictions to your practice of healthcare, just as you bring moral convictions to your ordinary everyday life. What the moral principles do is help us make the convictions we already have coherent, understandable. Understandable in terms of helping us identify the reasons why we have these moral convictions. But the principles don't impose convictions on us. They make sense of the convictions we already have. The second point is this. You can't use these principles mechanically. These are not like mathematical formulas that you can apply to your moral dilemmas and bingo, produce a solution. Rather, these principles, again, illuminate what the issues are and where our reasoning and attention needs to be directed if we are to find for ourselves what we believe to be a valid resolution of these moral dilemmas. Which is to say, as Bluestein and Post do, we must use these principles with great moral sensitivity and insight, not simply applying them mechanically to the issues we face. The second unit, which I am calling Professional Relationships and Contexts, focuses on some of the key relationships that form the context in which healthcare professionals practice their craft. Our discussion of the principle of fidelity has already suggested that we practice in various relationships, and those relationships generate morally valid expectations that people have of us and that we have of each other. We've already taken a glance at one of the relationships that shape professional life, your relationship to other people in your profession. We might say that the codes of professional ethics, which you have already looked at, are an attempt to define and spell out the legitimate expectations that other people in your field have of you because you are practicing in this particular field. Or we could see it as legitimate expectations that society has of you, since these codes are somewhat negotiated between professionals and the broader society. But these codes define society's legitimate expectations of you in your particular profession. This unit will focus then on some of the other key relationships. Now, first and foremost, I think everyone agrees that your primary relationship and the most important relationship is your relationship to your patients or clients. Most everyone who works in the field of biomedical ethics would agree about that. That responding to the needs of your patients, meeting their legitimate expectations of you, is your most important moral responsibility. We will look first in this unit at one of the most significant of those expectations, that you will treat your patients with respect by gaining their informed consent to the interventions you perform on their behalf, that you provide them truthful information and do your best to be sure that they understand that often complex information so that they can make competent decisions about their health care. And then you must honor those decisions. These may be your most basic obligations related to that primary relationship that shapes your profession, the one you have to your patients. But you will practice as a part of a healthcare team in a relationship not only with others in your own profession, but with persons in other professions, other professional roles, and with other responsibilities. And that in that team of healthcare professionals, not all the professionals are equal necessarily. Indeed, you will often be working in a context in which a physician is generally recognized as having primary responsibility for patient care and a kind of authority over other professionals in that team. You will also be likely to practice your profession in an institutional context, a hospital, an adult care facility, a rehab center, or a clinical practice, which will put you in relationship with others, not all of whom are healthcare professionals. You will relate directly or indirectly with CEOs, accountants, various compliance officers, and administrative staff. All of these have legitimate expectations of you, as does the institution as a whole, who will probably have some kind of code of behavior or code of ethics for its employees. We will look at one particular common feature in many healthcare institutions, especially hospitals, the ethics committee, and how it relates to your work, what its legitimate expectations of you are, and what your legitimate expectations of it can be, and how you relate to that committee. Finally, in this unit, we will look at someone else who has legitimate expectations of you, someone else to whom you must be faithful, yourself, right? Some would argue that, in fact, your most fundamental moral obligation is to be true to your own conscience. We will look then in this unit at the idea of moral integrity or wholeness, and the challenge to it that healthcare professionals often experience. And we will think about what you should do when patients, your profession, your colleagues, your institution imposes expectations on you and on your conscience that you simply cannot bear without a great deal of guilt. So that's the last issue we will look at in this unit. What should you do when your own conscience points you in one direction, and the other people who have expectations of you, and your code of ethics, maybe your professional code of ethics, point in another direction? What should you do when you conscientiously object to what most of those around you are suggesting you ought to do? Well, should be a fun unit, and I look forward to facilitating your learning as we move into these concrete issues in professional life.